Hello and welcome to another episode of the Late Aesthetics Show. I'm so excited today to be joined by Claire. Claire has got an absolutely fantastic story about how she got into the industry, and it's a really nice story. So thank you so much for being with me today. Tell me about your background to start with, and then tell me, how did you get into the industry that is known as aesthetic medicine?
To be fair, I started in a completely different route. So I went to uni to actually be a dancer.
Oh, okay.
And I was at an age where I just turned 18 and I just literally wasn't ready for uni.
Yeah.
And I remember being in uni and thinking, I don't want to be here, and thinking I need to make that phone call to my mum and say, I want to leave. But I thought, if I haven't got a backup plan, what am I going to do? So I left and I'd become an aerostess.
Oh, okay.
But what used to happen was they used to employ you for the summer, and then come the winter, you'd be off contract. So I was like, what am I going to fill my time with? So I become a skin girl on the counters for Clinique.
Okay.
And that's how I tended to get into beauty. But I was always into beauty. So from a young age, 3, 4, my nan was putting me into like beauty pageants. And then I started doing beauty pageants from the age of 18 onwards. So I was always immersed in that kind of world of beauty and glam. So it always all fitted in. Like the aerostessing was so glam at that time. You know, you had your full face on. We were selling beauty products. But although like I was on board, there was always that safety aspect to it as well. So there was so much first aid that we did when we were up on board from that safety perspective. And then I got into my 20s, and to be fair, my mum was always into having her aesthetics treatments. And so I'd go with her when she was getting like a Botox and lips done. And I was like, okay, what is this? And I was obsessed. It was just like a natural progression, to be fair. So I went and worked for Clarins, and I did my level 3 beauty at that point, and I become one of their facial girls. And then it was just something I was drawn to when it come to aesthetics. So I actually started in the industry as a non-medic. Yeah. And as I was going through the industry, I was working with a lot of medics, and I really, really was just pulled to come and do my nursing. So I went back and did my nursing, and it's probably one of the best things I did, because I got to a stage with Aesthetically Perfect where I just couldn't grow no more. I needed just to really elevate. So I went back to uni whilst running a really busy clinic, and I was just like, I was like a dead woman. But it's probably one of the best decisions I made as well, because it really, really elevated me to be able to work with all the pharmaceutical companies and really bring that safety through. Because the time that I went through to do my nursing, I really seen a shift in aesthetics, and it really become an industry that I was thinking, this is a scary place to be working in. Yeah. I found that patient safety just wasn't being kind of respected, and I was just like, I want to kind of make a difference and speak out. And to be fair, there's so many of my friends who are still non-medics, and just me going down that route of doing my nursing, I've influenced them to really go and elevate themselves as well. So I feel like you are getting that kind of shift of the really good practitioners that are non-medics and thinking, okay, let's go across as well, because they're seeing just how the industry's become.
Exactly. And you know yourself, there's a huge debate going on at the moment in the UK about regulation.
Absolutely.
And predominantly the lack of regulation that we have.
Yeah.
And you're right, it's scary. It's scary because anyone can start doing the treatments that takes or should take years to qualify in. So are you a big advocate for regulation in the industry?
You know what, I am, because I feel like I'm hearing a lot about level 4, level 5, level 6, level 7. And I feel like even that doesn't really, it still confuses. Whereas I feel if there's just a direct route of, there's a government body that you're governed under, and these are the qualifications you have, I feel that's what's needed, because I feel even with these other qualifications that are coming through, is there going to be that confusion still?
Yeah, and how actually regulated are the qualifications? A lot of them sound like made-up qualifications, whereas if you have a medical qualification and a medical degree, that's literally on paper. You have studied anatomy, You've studied the human body. You know different medical conditions to look out for, and that's another thing I think people forget is if you went to a medic for a consultation, they would do a full medical history for you.
Absolutely.
Whereas half the time, if you went to a non-medic that, doesn't really know enough about patient safety, they wouldn't necessarily run through that. And even if they did, they maybe wouldn't know what the different conditions would do as well.
100%. And I think as well, that's what I really, really kind of grasped when I went back to uni. That it's that autonomy with your patient. And although, because I read all the debates as well, when I'm going through social media, and I am seeing people who are saying, it doesn't need to be regulated. I've got this qualification, I've got that. But I feel like what isn't highlighted is when you go back to uni, it's the hours that the NMC make you put in. We can all study out of a textbook. We can all kind of sit an exam. But when you're on that ward and you're doing the placement hours, you don't know what's coming up. And that's where your experience comes in, I think, and that patient safety and that consultation process. Because, again, the human body isn't textbook.
Exactly.
So we see it. And it's the same as well when you're doing a facial or an injectable. Every skin type or every person reacts differently. And it's just having that experience. And I don't think you can get that without going and doing a medical degree.
Yeah. And I think that your skill set is like the perfect balance. Yeah. Because you've got the background of the skin, you've got the aesthetician side of things with the creative eye, but then you've got the medical backing behind it to back it up.
100%. And you know what? That's what I did as well, Vanessa, to be fair, because when I was in uni, there was sometimes that I'd be on wards and I'd be like, I know I'm not going to take much from this, but it's what you take from the opportunity of studying. So when I'd be on a ward, they'd say to me, what do you want to do today? And I'd go and ask and work with tissue viability nurses and just see how tissue would kind of regenerate, from wounds, pressure sores. So I think it's down to your learning base and what you want to take from it as well. So I kind of took from it, well, if I'm going to be here, I'm going to really, really extend my knowledge in skin health and skin vitality. And that's what I took from it mainly as well. Obviously, I've got the medical side to be able to back me. And I think as well, what you don't realise is it's that interdisciplinary team that you have that you take from that hospital setting into an aesthetic clinic. Because we're all lone workers when we're in there. But when you need someone to help, it could be a fellow nurse, doctor, pharmacist, you've got that team that's there that you can pick up and you've worked with them either on a placement or there's someone that can obviously direct you to. And I think that's where we're coming to, especially when you're seeing so much black market products coming through and people are understanding the importance of literally do not use.
Well, exactly. It's even, there's counterfeit toxins out there. There's counterfeit fillers out there.
Absolutely.
Even counterfeit Ozempic is now a thing, which it shouldn't be because it's led to 2 deaths that we've had in the UK. So it's all of this, and that's wrong, and that's obviously fundamentally what's wrong with the industry. But then again, it's platforms like this where we can educate the general public as to what's there and what's good and what's not so good.
And I think that's what we're finding as well lately. I find that you're getting people wanting to stand up and speak about it because so many people are seeing how dangerous the industry is, that you're having the likes of yourself and myself doing mini-series and podcasts really, really highlighting we need safety now, because I feel like we've lost that kind of, where is collaborative kind of thing in the industry, whereas people are collaborating together now and say, come on, let's really stand up for the industry, because we've got an industry that is such a great place to work, but it is being liquidated, and not saying cheapened, but we're seeing people are going to the nearest clinic and paying the cheapest price because they're not aware of what's being used.
Exactly. No, I mean, look, I've always had the stand that non-medics are if you're a fantastic aesthetician, you're a fantastic aesthetician.
Absolutely.
And what you've done is you've transitioned from that to be able to offer the more minimally invasive type treatments, but in a safe manner, so that your patient's in the safest possible hands, which is great. And obviously, it's not that every single doctor is a great injector. I mean, come on, that's not realistic whatsoever. Just because you're a doctor doesn't mean that you can inject. You still have to study, you still have to perfect your craft. But I think as well, the whole anti-aging game as a whole is a lot more than just injectables.
100%. And do you know what I do as well, Vanessa? To be fair, if someone comes into me in clinic and they say, this is my budget, I've got £500, £600, what am I best doing? The first thing I do is look at their skin integrity. And if I find the skin is aging, you know, it hasn't got a good home routine, the first thing I do is say, look, let's not do Botox and fillers, let's get the skin right. And quite often, if I've got like a lady who's in her 40s, been a smoker, lifestyle habits haven't been the best, and I can see it's really took its toll, I'll often say, let's get on a course of Abargi.
Yeah.
Let's start with Tret. Let's get that tretinoin in the skin. It's a great product for anti-aging. Because I always say, if the canvas is great, you know, we don't need to spend a fortune on fillers and Botox.
Yes. Yeah.
Because what you're doing then is you're setting up a patient thinking, if I go and give her 3 hours of Botox and a mil of filler, I'm fixing that whole canvas.
It's not an end. You're not managing their expectations.
Absolutely.
I can remember when I first started out in the industry, and so many people would think, for a start, Botox and filler are the same thing. That they would think that they're the exact same thing. Or they would be like, I want to do some anti-aging. Is Botox a good option? It's the ones that are like, give me 3 areas of Botox. And it's like, come on, like, if you've not
so far now,
so far. Like, but the thing is, if you've done nothing to look after your skin for years, that's not really, all that's going to do is stop the muscle from moving. Absolutely. It's not going to address the lines that are already there, the sun damage that's already there, the poor condition that the skin's in. And and if you can, I think if you can improve the overall skin health, then like you're saying, the canvas is improved. So then you're going to have that naturally glowing appearance.
And I also say, I think a lot of people, and you know, there is a lot of us now that are really, really like pushing for internal health, because your internal health shows that externally. And I feel like we have had that shift in the industry where people are really saying, look, it's about overall vitality. Make sure the inside's great because it showcases on the outside.
Yeah.
And I'm really seeing people are starting to listen. And so I really feel in clinic, I'm doing so much more skin, because right now skin is in.
Yes.
I always say skin is literally skinning right now.
And you're like quite a skin geek as well, which is great.
And it's another product I'm really, really huge on is Sculptra. I feel like if you've
been around for ages as well.
Yes, absolutely years. And I think what people forget is with Sculptra, it was back in like the 60s when we had obviously the AIDS pandemic and people really lost a lot of tissue. And dermis tissue, that's what they used to use to really nourish the skin and thicken the dermis back up. And then it kind of fell off and no one was really having it, whereas now, I mean, you used to see it over in the States, everyone's Sculptra, whereas now you're really seeing it coming through the market now. And I always say when people are coming into me and I can see like the stretch on the skin, that thickness of the dermis is gone, let's do a vial of Sculptra, let's get you on the tretinoin, and then let's then look at other things that we can do, because I feel like the overfilled look, it's gone.
Yeah.
People aren't wanting it. Dissolving's huge right now.
Are you doing quite a lot of dissolving?
So much.
And corrective work? Do you have to do quite a bit of corrective work as well?
Do you know what it is? It's down to as well is quite often we'll dissolve and we'll just go on to skin treatments or we'll do like kind of polys or...
Yes.
I'm more a Sculptra than a polys girl. I feel like kind of Sculptra, you know, you're going to get that 2 to 3 year out of it, and then you can just do under the eyes with polynucleotides. A meal that I absolutely love right now. I feel like that's really, really good. But yeah, I am noticing so many more just go to them undetected kind of results.
It's like and it's the small, minimal, subtle changes.
Absolutely.
And I always think one of the best compliments you can have is not what treatments have you had, and that's not the best thing. It's like, oh, you're looking good. Like, what have you been? What are you? What's your routine? And that's what it fundamentally comes down to. You mentioned you can do like polynucleotides under the eyes. So I had a course of treatments under the eyes. I absolutely loved it. I thought the results were fantastic. And even for like small fine lines, it just helped to refresh and re-brighten that area. But dark circles is something that I would say it's one of the most common complaints that we have or that we see in the industry.
Absolutely.
What's your view on how do you treat dark circles?
So dark circles is a big one. Polynucleotide is probably something that I would direct them to, because I think if you're going to put a trough filler under there, it's quite a hard one tear trough, I always say, if your lady or your gentleman is holding any water retention, it's a tricky treatment. Quite often you're putting it in and then you're dissolving it. So I always say, try polynucleotides first, unless the depth of that trough is quite deep. And they're going to need, obviously, a tear trough filler. A lot of people don't realise sleep is one of the biggest things that can help anything when it comes to skin. You know, plenty of water, like kind of a good eye cream, you know, and great sleep. You know, a lot of us just live on caffeine diet.
We do. Oh, I know, but it's not great for your skin, at all. And I think people forget the skin's the largest organ in the body. You need to nourish it. You need to look after it. You need to protect it and give it the nutrients and the protection that it needs, like we would with our other organs.
I use a product called Glower because I was literally, my hair was going really thin. So I started using Glower and my hair went so thick. My skin went absolutely gorgeous off it.
Is this like, do you take it as a supplement?
Like a supplement.
Yes, yeah.
And it's obviously, that's a really great, it's got something blocker in it. So it really helps kind of everything regenerate through.
Cool.
So that's another great vitamin. And I think vitamins are a big thing as well. Collagen pouches.
Yeah.
You know, there's so much out there.
Well, we don't get enough vitamins just from the food that we eat. And, you know, the reality is we just don't. So we have to supplement.
Yeah.
And obviously, if you're a vegan or a vegetarian, you need to heavily supplement your diet because you're just not getting the nutrients your body needs.
Exactly. And I think what happens is, it's like when you look at Brad Pitt now and Demi Moore, you know, they're like in their 60s and they're looking fantastic. And it just goes to show, just because we reach our 40s, life isn't over. Like, if we really, really look after ourselves internally, you know, 60s, we're looking pretty good now. And
well, exactly. And it's all this thing, 50's the new 30.
Yeah,
that's it. And you're quite right. I mean, celebrities nowadays are like aging backwards.
Yeah.
If you look at like Lindsay Lohan, she looks amazing now.
Absolutely.
But she doesn't look like a different Lindsay Lohan. She just looks like the best version of herself.
Absolutely. And you know what I think it is as well? It's kind of like that holistic lifestyle as well. I know for me, I do a lot of breath work. I do a lot of like yoga and just have that mental clarity, because I think what happens at the moment is with social media, it's so easy to compare, and you're comparing against something that just isn't real.
Yeah.
And that's what's hard at the moment. So I think that's what was great with my nursing. I was so able to identify in clinic after I did it with body dysmorphia, and just how tough it is on the younger audience right now that are coming through. And you just think, I mean, I'm nearly 40. I didn't have social media at that age.
Yeah.
So I felt like I had a good 20s. I wasn't really influenced over it. But then when it started coming through my 30s, you do start to go, do I need that? Do I need that?
And it's the insecurities that I think social media plays on. Like, I think my generation, so I was born in 95, is one of the last generations that didn't really have social media growing up. Like, my first phone was a Nokia 3210 where you could play Snake on it. Great game, like really good game. It was fab.
It was so robust until you dropped it.
And then I had one of those like Motorola flip phones, the pink ones, and the other ones that you like flip round. And they're probably like collector's items now. I would definitely think that. But don't think Instagram was the early 2000s, I think.
Yeah.
But even then, like we used to have things like Bebo. We didn't use Instagram. We weren't just seeing pictures constantly refreshing. Now the amount of times that I go on Instagram on a daily basis, I can imagine what that's going to be like for someone who's just growing up. They're like early teens, 14, 15. They're trying to find their own identity. Yeah. It can be quite hard.
Absolutely. But I think you can see that in the aesthetics industry as well. I mean, you know, take it back to before COVID. Your business was very much before and afters. Yeah. And everyone's Instagram was before and afters. It was all like lips or like packages and stuff like that. Whereas I'm noticing there's a shift this year in pages. And a lot of people who are serious about their clinics, they're doing a lot more of, it's more about themselves coming through and knowledge-based. Yeah. And I feel like you're getting the informed consumer coming through, whereas they were at home during COVID and they could research skin. They were coming and they knew what dermal fillers and Botox was. Yeah. And I feel like that's what is the new thing that's coming through, that they're more attracted to the business that sat there talking about that knowledge and educating them rather than the before and afters.
Exactly.
Because I know myself, I'll go through like the explore page and I go, that's just boring me before and afters.
I know. Yeah.
I feel like they're more trusted to come to a practitioner who's out there speaking out and speaking about treatments or educating them more.
Yeah.
And are you finding that?
100%, because I think it's the knowledge, and I think that we're responsible for educating.
Yeah.
Without us educating our consumer, we can't expect them to know, because the industry's grown so much. It's such an accessible industry to get into. It's difficult to know what's good and what's not good.
Absolutely.
So we have to educate them as to what is good and what's not, basically. Yeah. And you have to go into a clinic where you're having a consultation and that practitioner is giving you different options.
100%.
They're not just saying, you know, I'll put 8, remember the 8 mil like facelift that you used to be able to, with like, it was like with Juvederm, wasn't it? Yeah. It was like the 8 mil, the 8-point facelift with 8 mil, thinking that's...
And all the ratios, it had to be done that way, whereas everyone's
different. Exactly, everyone's different. So that was only like 8 years ago that was a thing.
Absolutely.
And look at where we are now. It's about subtle enhancements that's going to help to regenerate your skin so that it's putting your skin in the best possible condition that it is.
100%.
And imagine that big shift in only 8 years' time. 8 years, you know. I don't really know many practitioners that are doing 8 mil of filler in like one go and saying that that's like a mini facelift.
That's, I think, what people are doing now. Like they're breaking it down and they're bringing it back to basics again. And I think what they're doing again is they're seeing what their home care is like. They're literally fixing the home care first. Because I know sometimes ladies will come in and they'll say, can I have that laser? And I'm like, your laser's like your final gloss.
Yeah.
There's no point me doing you one laser and you spending £300 with me, because all you're going to get is a week's worth of good skin.
Exactly.
And I think that's what is getting the trust of your clinic back. I think it's people coming in, because I mean, you might be similar to me. I lose money so much because they come in and I turn them away and I'm like, no, it's just not worth it, because
Agree.
they are ultimately your walking advertisement.
Yeah.
And I think if they look great, you look great. I mean, you're doing your job.
Exactly.
Correctly.
I agree.
And I think that's what you want now, isn't it? You don't want someone walking around and they just look so overfilled, because when I look back, it ages you. If someone's done incorrectly, you just think they look so much older.
Exactly. And do you remember, I think it was Faye Winter from Love Island, she massively publicly spoke about her lips. And I think when she was in Love Island, her lips were very, very full. Yeah. And she tried to reduce them. So she tried to dissolve them to make them smaller and more natural. And Molly May did the same. Yeah. However, because she'd filled them so much over the years, the skin had actually stretched. Is that a common thing that can happen if you overfill the lips?
They normally do, obviously, because what normally happens is obviously it's your hyaluronic acid. When we dissolve them, the hyaluronic acid kind of gets stuck as well, so it gets a little bit dehydrated. They'll always naturally go back, but I think it's that misconception of you remember them what they was when they were bigger. So when they come to this tiny size again, you're a bit like, oh my God, my lips are completely destroyed.
Yeah.
The tissue will rebuild itself. You know, we're constantly got fibroblasts kind of set off with that collagen and HA regenerating. You know, we're not in our 80s yet.
Exactly.
Completely.
I know.
And I think it's just about, again, educating them and saying, let's do it in moderation. Yeah. With softer fillers as well, because I think it depends what fillers you're using. And that's what I tend to do with my patients now. I actually give them their little barcodes.
Yes, from the box so they can take it. And that's a sign of a very good practitioner, because you're using trusted product that you're buying from a trusted pharmacy.
Absolutely.
Yeah.
And I think that's what people don't realise when you do step across to the medical side of things. You've got so much support from pharmaceutical companies like the likes of Galderma and Allergan. Like, they put on huge conferences, huge like lectures throughout the year. And I mean, you're learning from people all over the world, because everyone injects completely different.
Exactly.
Everyone's got different kind
but
of...
even different ethnicities, you've got to inject differently, because their structure is very different. That's why it's great going to the conferences, you know, either once or twice a year, because it's new injectable skills that practitioners do pick up.
And the thing is, it's something that money can't buy.
Yeah.
That education you get from them conferences is just outstanding.
Exactly.
And it just comes through your clinic, and you notice your own scope of practice changing when you're going, I'm going to try that. Because I was at the last Galderma one, and one of the doctors over from Sao Paulo in Brazil come over, and she showed me how to inject the cheek to lift the ligament.
Oh, amazing.
And I've been doing it, and it just looks seamless. That G-curve comes, and it's seamless to the zygomatic, and it's like, there's no filler detection, and I'm just like, it's like a bit of Picasso.
Yes, it's exactly like that. But it's an artistry, isn't it? It's totally an artistry. You can't inject everyone the same. Like, this is it. And this is why it takes a skill.
Yeah.
And I just think it's so admirable that you've gone through it all to get to where you are now, to be the best possible practitioner that you are. And even when you get to that point, you're not stopping.
No.
You're constantly, learning new things, introducing, because even just this year was like the rise of exosomes. Did anyone know what it was?
Exosomes. You know what? It's funny because I had a little podcast with Dr. Cam. Sorry, I met him at the A-list in
Belfast.
In Belfast.
Yes.
And I put into production in 2021 my skincare company called APS. And it's just beautify. It's literally simplifying beauty. Because when I was working on the counter like Clarins, it was always cross-sell. This moisturiser needs to go with this wash. And it was something I never agreed with. I was like, there's so many great products out there to just literally put them together, and they literally work so well synergetically together. So I wanted a small brand for the Gen Z, always on the go. And I just literally did 4 capsules.
Yeah.
I capsulated them for hygiene and potency.
Yeah.
And I did 2 masks with biocellulose, because I just thought biocellulose in a burns unit, literally the best way to integrate them ingredients into the skin. And when I was researching ingredients, one of the ingredients that come up was Centella acetica. And I was just obsessed. I was like, it was just everything about that ingredient, how it regenerates the cell. I was just like, this is what I want to put in this eye mask and face mask. So I went over to the A-list, and Dr. Cam's doing his exomes with over DAX, and I hear Centella. Well, my ears just pinged.
So this was an ingredient that was obviously used within the exosomes that you were talking about. Great.
So what Cam was saying was, obviously, he prefers plant-based exomes.
Okay.
And he uses Centella.
Okay.
So it was something that I'd used with APS, and it was just so good to see this ingredient coming through the industry.
Yeah.
Because just the potency and how well it just literally of its cell kind of turnover, it's kind of like healing and wound regenerative purposes it's got, and to see it coming through in exomes, it's really going to be big in the market.
So the travel tourism sector is so scary, and I think it's just grown and grown.
Yeah.
I mean, look, it's not to say every single hospital or clinic that you go to abroad isn't skilled, but the problem is you'll get young girls, 18, 19, that will go, they'll pay about $3,000, they'll have liposuction, they'll get a BBL, they'll have fat transfer, they'll have the full facelift. It's so unethical to do that.
And this is it, and this is where does that kind of line stop? Like, because I know if you were to go to a board certified surgeon in the UK, the probably maximum they're going to do is do either a mummy makeover, so that your breasts and maybe a mini tummy tuck and maybe a little bit of liposuction. They're going to become a point where they're going to say, when we're throwing facelifts in at the same time, the body just can't deal with that much pressure.
So much trauma to the body.
This is what I mean. And I've seen patients that have come over and they've literally had liposuction and literally a tummy tuck, and the wounds haven't been healing. They've been in the NHS, haven't received an NHS care with air vac machines, removing all that infection. And then they're flying over to Turkey, they're taking the NHS machine off, stitching them back open, and they're still full of infection.
That's crazy.
And then they're coming back over, and literally the height of risk of sepsis that we've got with that, and then it's our NHS fixing it.
No, it is. And then it's just the whole process of it's putting a toll on the NHS. Sometimes the NHS don't have the resources to correct that as well. So you have to go down the private care route. But then I've heard horror stories about wards where after liposuction procedures, there's 6 or 7 people in a ward, no infection control, literally it's not a sterile environment whatsoever. And then they're flying home 2 days later, stitches are opening up. There's not the aftercare there either.
Well, I mean, you know yourself, even when they just come in from something non-invasive, just either a lip filler treatment or anything toxins, it's advised not to fly anywhere for at least 7 to 14 days. But then we're putting people on flights where
after a full surgical procedure, like 2 to 3 days later.
And it's not only that, what we're doing then is putting the pressure on airlines and stewardesses that, God forbid anything happens up there.
Yeah.
I've got to deal with that as well.
Well, exactly, and the wounds are still open, so there's like fat leaking out and all of this, and you need to be in the care of the surgeon and his team after a procedure like that.
Is this where it comes to the point of, because the reason this is so vastly consumed right now by young people, I think, is we've got the likes of celebrities and we've got influencers, and they're all out there, what they've had done, they're tagging where they're going, so they've naturally got.
But then there's the whole thing about how that's not ethical. They shouldn't be like advertising it.
Exactly.
Yeah.
And
they're using code like whatever, get a discount, you can look like me. Come on, that's completely unrealistic. It's so irresponsible for influencers and celebrities to be doing that.
Absolutely.
And then you've got celebrities like Molly May, for example, who she is like, because her target audience is young females, she had her face dissolved. The clothes she's wearing, she's so much more natural looking. And all credit to her, because what she's doing, she's targeting that core audience that are influenced by the not so great procedures. Absolutely. And she's saying like, look, I dissolved my filler. You don't need to do that. And she looks absolutely fantastic.
She looks incredible. We did a little discussion over it and we were thinking, what has she had done since dissolving? And I was saying, she's probably still had little tweaks done, but they're so undetected. It's like the Michelle Keegan.
Oh, yeah, definitely.
She looks insane.
Exactly.
And we just think, most women have had something done, but it's just about, I think, that elegance of things and coming through and thinking, oh my God, isn't she beautiful? Wonder what she's had done. But she looks great for it.
No, I think Michelle Keegan looks absolutely fantastic. Molly May, Margot Robbie, Lindsay Lohan, Christina Aguilera, like they're all like influencers in their own right, but they're showing you that you don't have to be unnatural to look the best version of yourself.
And what I love about the likes of Molly May as well, she's really, really kind of putting out there to her community that she uses great medical skincare as well. You know,
and she has the treatments,
and she'll put it out there.
And she has the energy-based device treatments as well. She uses a good quality skincare routine. And I think that's important to say, good quality skincare routine.
Absolutely.
Because not all skincare is equal.
No, it's not.
And you need a consultation.
Yeah. And I think that's what you need to remember. A lot of things that people are using at home, sometimes a scripted base. And I think what we forget is when it comes to retail, when you put a product onto the retail market, it can only have a certain amount of percentages.
Yeah. Anyone can grab it.
Absolutely. Yeah. Also, this is what I don't get with the TikTok trend, because I know I've got nieces who are 8, 9 now, and they're using all the products out there. But when you have a product safety test, it shouldn't be used on anyone under 18.
Mm-hmm.
But now, because of social media, children are using these products on the skin.
Mm-hmm.
The skin isn't designed to be able to cope with it. It's not got that capacity to take them ingredients in, and we're probably going to find that as we're getting children coming older, that their skin is going to be in terrible condition because we broke that skin barrier
too young. I can remember, so I started to use it. I know you mentioned that you worked with Clinique.
Yeah.
I started using Clinique, I think it was like 12 or 13. Paint stripper, wasn't it? And I was thinking, why am I using this? And look, I was fortunate that I had really great skin growing up. I wasn't one of those kids that would get spots or anything like that. But I did start going for facials when I was like 14 years old, like spa facials, just using like very natural mineral-based skincare.
Absolutely.
Not skincare that I would use now, because it's not as effective on my skin now as it was when I was 14, 15. But you need to look after your skin even when you're, 13, 14, and not use something that's going to strip away the barrier.
Well, I think that's what a lot of teens, especially who have kind of got acneic skin, are forgetting. The thing is, they're using so many products and all they're doing is stripping oil.
Yeah.
And all that skin is going to do then is regenerate oil. Yeah. So I always think when you are suffering from anything like that, is go and see a medical professional, because there's so many products. I mean, I keep raising about Obagi, but they're poor therapy, you know, and products that they've got there, they're super kind. Obviously, they're medical based, but they're going to really help that acneic skin that's out there.
Yeah.
Whereas I think what happens is they'll go to retail and they'll just pick anything up because it says acne on it, and it's quite often not
Exactly.
for their skin.
No, it just says acne, and then they think, oh, that'll work. Again, because it's so confusing. Like, you go into Boots or you go into Superdrug. I was in Boots yesterday. There's about 25 different skincare options that you can pick from. And you're walking around, you don't know what to buy. Like, you don't... And with all due respect, nobody really, they're not medical professionals.
Absolutely.
They're not skincare specialists. Yes. So they're going to sell you what they need to sell you.
A great tip for that is whenever you put a product out there, so if you're advertising this has retinol in, for instance, you'll be able to know the potency of that retinol and how much of that ingredient's in there. So always turn onto the back and see how far down
it is on the ingredients list.
And you'll always be able to tell how good it is.
And then you want to avoid anything knowing on the ingredients list. It's like aqua usually is number one. Yeah. Then you've got like sulfates in there, sodium lauryl sulfate. They put that in everything.
Absolutely.
Avoid that. If that's in your face wash, you do not need that in there. It's going to strip your skin.
And I think a lot of things as well, especially when ladies are coming through to me and they're like 18, 19 and their skin is just breaking out. You know, there could be so many underlying issues, you know, have they got polycystic ovaries, you know, is there symptoms there? So I always say, look, before we go and do anything, let's get you tested. Yeah. Because we know what we're battling with then. What's going on internally? Because again, it's going to show externally with us. And there's just, I think that's why it's just always great. Go to a medical professional who's got that skin knowledge.
Do you think that there's a difference? This industry, do you think there's any difference between doctors and nurses? Sometimes I found over the years that doctors kind of sometimes regard themselves as maybe slightly more experienced or more qualified than nurses. Have you felt anything like that in the industry?
I haven't so far, but I feel like what happens is obviously we all go to university, we all got our standards, obviously training. But it depends. I think when you come into aesthetics, it's which way you then go and kind of flourish. If you want to be more skin, you're going to go towards more what works for the skin and stuff like that. Do you know what I mean? So I think when it comes to aesthetics, you're kind of even playing ground because it's what you go then to kind of specialise in.
Yeah.
I would say mainly.
And I think medicine as a whole is a huge
Absolutely.
area.
Yeah.
Aesthetics is one small part of medicine.
Yeah.
And then within aesthetics, there's so many other specialties that you can go into.
That's it.
And I actually have personally found that this industry is very collaborative.
Which I love.
Yeah.
And it's funny you say that because that's actually really true. So I've got a friend right now and he's got Crohn's and he's got a terrible kind of infection and it's coming all down his ear and
Oh, no.
So they've said that it's a little bit of staph, but he's had antibiotics, it's not working for him. So I just reached out to my friend, Dr. Maeve, and she's a dermatologist. And first thing she said to me, I think it's something to do with absorption. He's not getting the right nutrients from his food. And basically his body's kind of causing an infection.
Yes.
And I think something like that, although like I've got my medical side and my skin side, I'd never known that until I went over.
Yeah.
Do you know what I mean? To speak to Dr. Maeve, who kind of, and I thought, I had a feeling it might be something to do with his Crohn's, but I was thinking, I wonder what is triggering it, because it's not fixing from antibiotics, it's resistant.
Yeah.
So, and you're always learning.
Exactly.
So now I take that to my clinic, because like, well, could it be this? Or...
Yeah, exactly. No, you are. And I think the whole industry works well because even things like women's health, that's becoming a lot more talked about. There's a lot more practitioners that are specialising in women's health.
Absolutely.
Which is fantastic because it's something I think the industry was lacking for quite some time. But it's right, it's the whole aesthetic medicine industry as a whole. It's a holistic approach to how we treat the patient. We don't just look at them and it's like one shoe fits all. It's not that. It's kind of like everyone's individual. So you need a bespoke treatment plan for you.
I think what it is as well, it's such an opinionated industry, isn't it? And I think everyone has their own opinions on things, their own ethics and things. And do you know what's a great film that really, really, I think, as a whole, brings medicine together? There's a film called Joy on Instagram.
Okay.
And it's about the first IVF baby.
Oh, okay.
And when I was watching it, there's a couple of doctors and nurses that really, really believed in IVF back in the 1920s, I think it was the rest of the industry was so against them. Like, obviously, the church was against them. Yeah. They were just like, this is wrong, what's going on? But they were so passionate, they said, about making mums, because it was a disease. They couldn't physically
have children. Yes, exactly.
And they were kind of the relationships were breaking down, the marriages, they didn't feel good enough as being a wife because they couldn't provide a spouse.
Yeah.
And to see now where we are in today's modern society where IVF is changing so many lives, it just goes to show sometimes in this industry we have to be a little bit open, even though the times might be
exactly different. Exactly. And look how far we've progressed, like, from there. So no, it's fantastic. I think that rounds up our conversation really, really nicely. I could sit and chat to you all day. So we might have to do a part 2 at some point. But Claire, you've been such a great guest. Thank you so much for joining me today. And anyone who wants to reach out to Claire, follow her on Instagram. It's Aesthetically Perfect, isn't it?
Aesthetically Perfect UK.
On Instagram. And anyone who wants to subscribe to my podcast, just hit the subscribe button. Thank you so much.
Thank you so much. It's been great. Thank you.